In this video, you will learn about your feeding tube and how to use it. You will also learn what to do if you have any issues at all with your feeding tube. Basic anatomy. When you eat, your food travels down your esophagus into your stomach. Your stomach serves as a reservoir to hold food, and it empties slowly into your small intestine, a little bit at a time, at a very controlled rate. The jejunum is the second part of the small intestine, and this is where your feeding tube will be. What is nutrition? Nutrition will play an important role in your health. We'll start with a nutrient called protein. Protein is mostly broken down in the stomach and the small intestine, and this is in food. It builds muscle if you use your muscle more, and it also protects the muscle that you already have. Some food sources of protein are meat, dairy, eggs, nuts, and beans. Protein is also in your tube feedings. Carbohydrates are also a nutrient. Carbohydrate digestion begins in the mouth, and they give you immediate energy. Sugar, grains, and milk products all have carbohydrates. One of the main sources of energy in your feeding tube formula is carbohydrates. Fat is also a nutrient. Fat digestion begins in the stomach, and it continues in the small intestine, where your feeding tube is. Fat helps you absorb vitamins, and it gives you healthy skin and hair. Your tube feeds actually contain fat, but different kinds, to help your body absorb it best. Vitamins and minerals are also an important part of nutrition. They help your body's cells function. They help your metabolism and brain. Your tube feeding formula contains vitamins and minerals to meet your daily needs. Most of the time, 4 cans of tube feeding formula will meet your vitamin and mineral needs for the day. Water is essential for your life. Your body needs 1 to 2 quarts, or 32 to 64 ounces of water per day, in addition to your food. Water can be given through your tube, up to 8 ounces at a time, with a large syringe. It's easy to forget to give water, but it's very important. Just as you would drink it, your body needs the extra water through the tube. The benefit of water is that it also prevents your feeding tube from getting clogged. Take a look at your feeding tube. The tube that goes into your body enters into the part of your small intestine called the jejunum. This is going to provide you with enough nutrition to get through treatment or recover from surgery. Hi, Mr. Harvey.
Hello, Meredith.
Nice to meet you. I'm Meredith. I'm the dietitian, and
nice
I'm going
to
to
meet
teach
you.
you how to use your new feeding tube. In order to use your tube, you'll need your feeding tube cans that are usually sent home with you or delivered to your house. You'll need a pump bag, and you'll need a cup of warm water, and you'll need your syringes for that. So
Okay.
we have all of that sitting over here, and we'll get started. The first thing you'll do is you'll open up the bag. You get a new bag every day, so you don't have to reuse the bag. And this bag will hang from your IV pole.
Okay.
I usually hang it a little bit further away. And I tend to just open up each can one at a time and pour it into the top of the bag.
Yummy.
It looks delicious, doesn't it? The bag will cap if you press tightly, and it will seal. We will start with turning on the pump. You hold the power button right here. We'll start with new settings, although you can keep your settings if they're the same every night. The first thing we want to do is we want to load the set. So you look at your tubing, and there's a stretchy part of the tubing right here. This is the part that you want to find. This attaches to the side. It loads just like this into the pump from the left to the right. Close the door. And the pump will know when it's set correctly. So now we have your feeding is in the bag, and it's going to run through this tubing. I usually keep the cap on until right before we start. The top of your pump will say set loaded. The first thing you'll want to do is you prime your pump. It's the top button right here. Auto prime is a great setting because it will prime almost all of the tubing so you don't feed yourself any air. So as you can see, the feed will start running through the tubing.
Seems pretty easy so far.
It is. You'll be great. It will prime almost to the end, but as you can see, you may have some tubing that doesn't have feed in it yet. For this, you can use the hold to prime feed button, which is the second from the bottom. All right, this can remain capped for now. And you press done. Now, before we feed, we're ready, but what's the first thing we do is we flush water.
Correct.
So I'm going to bring some warm water, and you'll want to draw up at least 1 syringe full of water. 60 milliliters. To release any air, you can turn the syringe upright, and then we'll flush it through.
Okay.
All right, so we'll attach this to the end, and we'll push the Lopez valve to on.
Yes, I'm noticing that there are 4 different spots on
Yes,
the valve, and one is off, and the other 3 don't have anything on them. Is that significant?
it is. So these arrows show you which way it runs.
Okay.
And the arrows, you want the arrows running up and down
Okay.
in order to feed. When you want your tube off so that nothing comes in or out, you push the off to the top.
So in other words, if it was like that, nothing would go down.
Nothing could go through.
Okay, so we'll
But
turn it
now-
on the on position.
Correct. Excellent. And then this will flush through. And you might have to put some pressure to be able to flush the water, and just slow and steady. But your small intestine can absorb water very quickly.
Right.
It can't absorb food very
Didn't
quickly.
feel anything.
Wonderful. A
Except
little
the
bit of
drip.
water. Excellent. So now we're ready for a night of tube feeds. You'll take this tip. You may have an adapter, and you'll push it into the end of the Lopez valve. And you'll keep it on the on setting.
It's on.
So we'll go to adjust feed. The feed rate is the top button. It has 3 different options and 3 different arrows. This one will be at 60 milliliters an hour, so it's the middle arrow. We'll adjust that to 60, and this is individual milliliters. Press enter, and that will give us the rate. VTBD is an optional setting, and it's the volume to be delivered. You can set it for 1,000 if you're running a pump bag. The next step is just to run.
Wow, that tastes good.
Excellent! We like the flavor of it. So if you need to go to the bathroom or if you need to move around, you don't have to roll this with you. You can, but you don't have to, because there's a hold setting on the pump. So the hold button is right here, and all you have to do is hold, and then you grab the cap, and you can disconnect yourself.
I see.
So if we need to hold it, we can disconnect and then just recap. Then you can run when you go back to your place. When you're finished with your feeds, you can see the history on the pump, so it shows you how much you fed. You can discard your bag, so you don't need that anymore, and then you can press done. And then the most important thing in keeping your tube clean and clear is that you need to draw up another 2 to 4 ounces of water when you're finished.
You want to eliminate anything that's food that's in there.
Absolutely. We don't want to see any food. And then we'll turn that to off. And you are set for the day.
Beautiful. Thank you.
Wonderful. Your feeding pump. Remember when we said that the stomach is a reservoir? It is very important to note that you must put all of the cans of your tube feeding formula into the bags that attach to your feeding pump. It is because those bags serve as an outside stomach to hold the cans of tube feeding formula. They will then feed into your small intestine at a controlled rate, such as what your stomach would do if the food was going through your stomach. You can give up to 8 ounces of water directly into the jejunum at one time, but the formula takes a longer time to process, so it must run through the pump. You will receive cans or cartons at home. Each can or carton is approximately 8 ounces. You can pour up to 4 cans into the feeding bags at one time. That equals about a liter that will run through your pump. The bags that you've received will fit 4 cans. You will pour the cans into the top of the bag and close the top of the bag while you run your feeds. You have been given large syringes that will hold water. Draw up 2 ounces at a time. You will likely be able to take 4 syringes of this water within a 5 to 10 minute period of time. The end of your tube has a Lopez valve. You will look at the left picture and see that the Lopez valve is turned on in that picture. The arrows run straight up and down where your tube can show you that it is open. When the Lopez valve is turned off, the arrows will run in directions that are not the tube. We can see here in this picture that if you make an X with the Lopez valve, it shuts off the tube and will hopefully prevent all leakage. If you have a liquid form of your medications, you can take this through your J-tube. Give it through your syringe and flush with 30 to 60 mLs of water or 1 to 2 ounces after you give it. If you have a pill form of your medication and it's able to be crushed, dissolve it in water and flush with 30 to 60 mLs of water after you administer your medication. It's very important to make sure that your medication is not an extended release medication. These cannot be crushed. If you have diabetes, it's very important to monitor your blood sugars. Check your blood sugar as directed by your endocrinologist and make sure you're communicating with your doctor. Some patients will require insulin with their tube feeds. If you do require insulin, you will give this along with your tube feeds. Your insulin correlates with your need for tube feeds. Most patients will give their insulin at the start of the tube feeds around 6 o'clock p.m. and another dose around midnight. It is very important to note that if you do not run your tube feeds at night, you need to not give your insulin because that insulin is directly affecting the tube feeds that you give. Cleaning and dressing your tube site will be a very important part of having a J-tube. You can use soap and water to clean around your tube in the shower. Some people prefer to have drain sponges that may soak up any little leakage around the tube site. Those drain sponges can be placed around the tube, close to the skin. You can also use medical tape to secure your dressing and to hold your tube in place. In the rare occasion that your tube clogs, don't panic. Call the doctor's office if you cannot flush water through your tube. We will schedule an appointment for this issue to be addressed. If you cannot take fluid by mouth, your appointment will be more urgent. Flushing plenty of water through your tube whenever you turn off your pump will help to prevent your tube from clogging. Sometimes the feeding tubes will fall out of your body. Again, don't panic. This happens sometimes. But call your doctor's office right away. If you cannot get in touch with your doctor within 2 hours, please go to the emergency room. We will schedule an appointment for it to be replaced. Occasionally, it will be difficult to tolerate your tube feeding formula and it will cause diarrhea. If you have more than 4 loose stools in a 24-hour period, call the doctor's office. We have a variety of formulas and we can maybe change you to one that would feel better. Sometimes the diarrhea is not due to the formula, but it signals an infection. You may need to take a stool sample to see if we can determine the cause of this issue. On the other hand, constipation can be an issue. Are you giving yourself 8 ounces of water, 4 times every day, in total you should be receiving 32 ounces of water through your feeding tube every day, minimum. If you are taking pain medications, you may need a stool softener or a laxative to help with the constipation. If you have any more questions, call the office at 980-442-6410. If you feel that it is an emergency, call 911.